All right. So, first thing I want to say is next week is the quarter mark of the semester, 25% of the way down starting next week. Isn't that crazy? So, in my experience, this is where we start to dip. And actually, if you, I know you're not looking at the screen while I'm taking attendance, but if you look around, there's a lot less people here today than there were last week and the week before, right? I think I think when we all start off the semester, we're gung ho, new class, new topic. What are we going to learn? Um, but then eventually, somewhere around this quarter mark is where things can start taking a turn. Now, there's some classes that you can make up ground. I think your medical terminology class, like you get a little behind that class, you can kind of make up for it. Anatomy. Anybody ever fall behind in anatomy? Good luck. It's a that's an avalanche. That's a snowball that's gaining steam on the way down. And man, if you fall behind in that class, it's so hard to get back together on that. This class, I think, again, depending on instructor, your level of interest in the class, your your interest in the individual topics we cover each week determines how quick you can make up for it. So the reason I bring this up is we've got an exam not next week, the following week in this class. So if you're starting to dip in your concentration, all right, you got a little time, make up for it. Let's go. Like, don't start falling behind. Um, I think it's easy to take on something new and juggle life for a little while. But eventually, if you're overextended, it starts to show. Um, just it starts to show just by showing up today. It might show up in just how many hours a week are you actually studying. It might show up in you're not sleeping well, and you're not when you are studying, you're not really there, and you're not really. You guys have had those study sessions before, where like, yeah, you put in the time, but man, that was a slog. It's almost like anybody ever go for a run and you say like, I hate every second of it, but then you look at the clock and go, actually, I made good time today. It's just every second of it sucks. You know what I mean? Like it's that kind of thing. Like, so what I'm saying is like, it's take a look in the mirror. If you're not doing a good job with balancing your life and still maintaining, if you're starting to dip a little bit, then look in the mirror. What can you what can you adjust to help you stay on track? And that's not only for this class, it's all of your classes. And we'll show you later today why all of them are so important and exactly which ones and why I keep talking about the three big classes, anatomy, this class, and your midterm. Um, but take a look in the mirror. Now, I'm not in charge of your bills, but maybe you have to take a hard look and say, like, I've got to work 32 hours a week instead of 40. This just isn't, I'm not balancing it all where I need to be. Um, so, you have advisors, there's lots of people at CCI that can help you. You can talk to me if you ever are. But if you're starting to feel that fatigue, we're not even at the quarter mark of the semester yet. So take a look in the mirror and start figuring out what you have to do to make sure you're on the course that you actually want to be. Um, so today we'll go over the education of both PT and PTA and some communication stuff as well. We'll look at these objectives. We'll come back to them. So first off, education of a PT. So first off, you have to have a bachelor's degree. Can be in any major. I had a classmate. Her undergrad degree was in art. She was an art major. And all of the other courses she took, she had to take all the prerequisites. So, anatomy, different biologies, physics, all of those prerequisites you have to do before you can apply to the graduate program. Similar to what you guys are doing, right? You guys are all in prereqs for the PTA program, anatomy, this class, and midterm. And there's some others that have as well. So once you get your bachelor's degree, then you can apply and hopefully you'll get into graduate school. So today, all PT education is at the doctorate level. Schooling must conclude didactic education, hands-on competency, and clinical education. What does that mean? Clinical education, that's a requirement. What does that mean, clinical education? Yeah, you got to go work as a student PT under the supervision. So those are internships. If you ever heard of that's an internship. So we have clinical internships. We'll talk about them on the PTA level a little bit. Hands-on competency. Anybody want to take a shot at what that is? We teach you some hands-on skills, and you have to show us you can do those hands-on skills safely. So we do that a couple different ways. Sometimes there's just hands-on quizzes. You say, okay, we showed you how to take range of motion of a knee. You show me that you can do it, right? And we just say, yes, you did it safely. Other ways we do it is with, so not only do we have written exams, we also have hands-on exams. Here's your patient, here's the evaluation, here's the patient, here's the next treatment. You go do it and I'll grade how you do with that. So we have, those are our hands-on competencies. What's didactic education? Exactly what I'm doing now. We're in a classroom, it's lecture, we're taking notes, we got notebook, we got our textbooks, we're going to take a handwritten exam. That's didactic education. So those three components are required with your PT education. Guess what? PTA education, all of those things are required as well. So I actually, in the PTA program, I coordinate all of the student internships. We have 3 internships. They're all 6 weeks long at a variety of different settings. And they're 40 hours a week. They're full-time, 40 hours a week. Your job is to go work as the student PTA underneath your clinical instructor for their full-time job. And there's no wiggle room around that. There's no, every single year I get, well, but I like to work on Fridays. Well, if your place says you work Monday through Friday, you're working Monday through Friday. So that's a requirement that we have to have. We also have hands-on competencies and, again, didactic education. Now, we are at the associate's degree. The problem with the PTA degree being at the associate's degree and the PT degree being at the doctorate level is there's no easy path. Once you're a PTA, there's no easy path to just become a PT. You can't just get into grad school. You still have to go get that bachelor's program first. So that's a barrier. There are 3 programs in the United States that are called bridge programs, where there are PTA to DPT bridge programs. So that you get to go there and you get to say, hey, I'd like to be DPT, and they'll help you get your bachelor's degree and then also your doctorate degree as well. So there's 3 programs, one in Ohio, one in Texas, one actually just starting up at New England Tech here in Rhode Island. I've had one student do the one in Ohio, and I've had a different student do the one in Texas, and they both said great things about both programs. I know the people at New England Tech, and they're great people too. So that is nice. What's also nice about those programs, those 3, is they're designed for the working PTA. They know you're working full time. So actually, both of my students were both Rhode Islanders, and they would work their regular jobs. They do all of their coursework at night and on the weekends, and then they'd have to fly to whatever college they're going to. It was, I don't remember if it was every month or every other month. Each program might be a little different, but yeah, you go fly and you do a 3-day in person, all the hands-on training, right? All of that hands-on competency that you have to do. So pretty good. You get to work and go to school. That's solid. And these are, again, give you that bachelor's program as well as the doctorate. So they're pretty good. So here's a little side-by-side comparison of the PTA versus DPT. Now, it's a couple problems. One, because the associates, like I said, there's no easy path to become a DPT. There are those bridge programs. The other problem with it is our insurers are look at us and United Health looks at us and says, all right, I understand the evaluation done by the PT takes more time, one-on-one. For the follow-up treatments, why are we paying the DPTs $80 for a visit and you guys have your doctorate degrees? Why are we paying $80 for somebody that has an associate's degree? We should be paying less. And they're starting to pay PTAs a little bit less. Now, I don't agree with that. No, it's not like the insurance companies are the most moral companies in the planet. I say you should pay us the same because we've got really great PTAs that are working their tail off and they're making the patients better. That's why you should pay us. But that is an issue. So there's always been, it says in recent years, for the last 15 years that I can remember, probably well before then as well, there has been discussion of moving the PTA degree from the associate's level to the bachelor's level. Because it'll help PTAs who want to become DPTs. There's one less barrier in place for that. And there's also some things for us to go back to our insurers and say, no, you should actually be paying us the same or more because we have highly educated people. What do you think some of the downsides of moving the education to a bachelor's level would be? Yeah, yeah, yeah. Paying for school for, this program at CCRI is a 2-year program. You got to take, if you could do all of your prereqs in one semester, so at least 2.5 years. You can spread it out, make it, 3. But yeah, going from 2.5 years to 4 years, yeah, that's an extra year and a half of school at least. Yep. Any other downsides? Absolutely. When we say, hey, it's a 2-year program, there's a lot of people that go, I could pull off 2 years. How many people couldn't pull off 4? Well, so cost is one thing, but just time. Like, gosh, 4 years to get there, like that can be tough. That can be tough. Any other downsides? We'll look at that later and in a few different ways. But yeah, so here's the other thing. Yeah, if you kind of like what you were saying too. If I'm going to spend an extra year and a half of tuition and I'm going to get paid the same, that's actually what happened to us with the DPTs. Like I don't make any more money than the masters of PT. I don't make a penny more. Actually, I don't make a penny more than bachelors of PTs. Actually, because they've been around longer, they've had more raises than me. So like, there's most bachelors of PTs make more money than I do with my doctor. Guess what insurance? Guess what? If bachelors of PT, MS of PT, or DPT treats a patient, how much do insurance providers pay us? All the same money. So yeah, I think like, so it's going to cost us more to get there. We're not going to make any more money. Doesn't seem like a very smart decision there. So yeah, there's some of those problems too. I also think having education be accessible to everybody is a big deal. And not everybody had a 4-year program is not accessible to everybody. There's a lot of colleges. I've had a lot of first generation students. I don't know if anybody here is. I've had a lot of first generation college students that would just be intimidated or have decided that a 4-year program is not for them. They're intimidated by it. Where at CCRI, it's what we specialize in. We're really good at educating those first generation students. So there's some accessibility pieces of that too. So CAPTE, we've talked about CAPTE before. CAPTE is in the APTA, Commission Accreditation of PT Education. It's responsible for evaluating all PT education. All PT and PTA programs in the country are under the purview of CAPTE. They come in, actually, they're coming in, I think it's 2 years. Yeah, I think it's 2 years. They're going to come in. They're going to fly in. Three different people from all different parts of the country. They're going to stay with us for at least 3 days, and they're going to look in every single drawer, every single file. They're going to open up every single PowerPoint. They're going to look at every single test. They're going to go through our program and everything we do and make sure that we do a good job with it. Um, they're going to sit down and interview me for a handful of hours and say, how can we do this? How can we do that? How can we do that? And I'm going to say, because I'm awesome. That's the way we should be doing it. So yeah, that's what their job is. And then depending on how good they do, they either say, okay, we'll come back in 5 years or 10 years. So, but yeah, that's what CAPTI does. Make sure that all of our programs across the country are of quality. Now, education of techs, that's on the job training. No formal requirements needed whatsoever. There should be some sort of documentation on that education. We have taught this person how to clean tables, and we keep it in the log here. We have given them the pamphlet on how to fold towels or on how to do the laundry or whatever it might be. There should be some documentation of that. But CAPTI has no role in overseeing of the education of PT techs because they're not in a program. They're just on the job training. What type of supervision should techs have? Direct, which means what? Line of sight. Good, good, good job. Yeah, so if anything goes wrong with the techs, it's ultimately on the people who are supposed to be supervising them, whether it's the PT, PTA, or even student PTs or student PTAs could all be the ones responsible for supervising those techs. Continued education is crucial. Number one, it's a requirement. So our PT and PTA licenses in Rhode Island, they expire every 2 years. We're all on the same cycle. So it's May of 26 is the next time that it expires. So we have to have 24 hours of continuing education every 2 years. What is it for teaching? You're teaching, sir. Yep. So you have to do so many hours and every.
I'm graduated teacher now, 5 years teaching, he's supposed to have his master's by now. That's the problem. So everyone does the extension. So
yeah.
Teaching full time, going a week to master's.
It's required to have a master's for teaching him? Really? Boy, that's a stingy requirement. What do you feel about that?
I think it's good. I mean, as far as professional development, but it's going to be related to, why you can get an advanced degree in something that you're not terribly interested in.
Yeah.
But it has to really teach certification. So
yeah,
there's a lot of plus and minuses.
Right.
You can argue with, and I think a lot of maybe you look at physical therapy, you go to a different state and you're going to apply. You have to make sure that you're endorsed. Make sure that you're licensed.
Yeah.
A copy of the license. Read a copy of the education.
Yeah.
It's like the money.
Absolutely.
My wife jumped back and forth between Rhode Island to Mass. She's been certified as a lifetime certification in Rhode Island.
Right.
Moved to Massachusetts. Oh, you got to take the NATEL again.
Yeah.
It's like every other thing.
Right.
Bureaucracy.
Absolutely.
Funded by money.
Absolutely. Yeah. So continuing education, 24 hours every 2 years, required in Rhode Island. Other states have slightly different requirements. Pretty much all of them. I haven't seen any states that don't have some sort of continuing education requirement. The exact number of hours could vary state to state. What is the group of laws that would define exactly how many hours in the PT world? What's that called? Said it like 40 times, I feel like already. Group of laws that each state has its own group of laws. Practice Act, yeah, good, Practice Act. So it's laid out in the Practice Act exactly what we do. So the good things about continuing education, now 24 hours every 2 years, I've never been shy of that. I've never had to, oh crap, license expires next month, let me go quickly do so. I think 24 hours every 2 years is very achievable if you are any level of professional. But continuing education, good things about it. Advances skills, enables therapists to keep up to date with the latest research techniques, best serves patients. I had a student in my Warwick class. He's actually he he's a circus performer, and he traveled the country. I forget what theater show, Cirque du Soleil type show. He was in a theater production across the country. And I pulled up the APTA website and I found it was telehealth for performing arts athletes. And the reason is because if I work for the theater group based in Rhode Island, but they're out in Sacramento and one of their actors gets hurt, how do I give them telehealth for that specific population? Awesome. So if I had a weird patient that I don't know, I could find a continuing education. I could at least have the basics to treat that patient tomorrow. It's also just the professional standard. So when we talked last week, we talked about how to avoid malpractice suits by making sure you're up to date. We've also talked before about the scope of practice, right? So in the PT scope of practice, wound care is part of it. It is legal for me. It is in the Practice Act that I could look at a wound, to grab a scalpel and do whatever they do with a scalpel to a wound to make it heal. I personally should not be doing that because I don't have any advanced training and continuing education to do that. So it helps us with our scope of practice and make sure we best serve our patients. So it's also ethical standard by the APTA. Do you guys remember the titles of the 3 ethical documents? It was Guide of Conduct for the PTA. We did it last week. Anybody have that on them? Guide of Conduct for the PTA, Ethical Standards for the PTA, and then was it Values-Based Behaviors for the PTA? I think those were the 3. I might be wrong on the exact wording, so glance at those. But when we dig into those later in the semester, all 3 of those have descriptions of the continued competence and making sure that you're up to date with all of the best education. Like I said, I've never been shy of 24 hours. I've never had to quick do a course to make sure you get your hours before the license expires. The coolest one, so recently I did a lot last year. How to become a better teacher, how to become a better physical therapy teacher. Like how we teach because of the hands-on skills, the clinical education, and the didactic. How we teach is a little different than how the math professors or the communication professors that you guys take classes with. We have a different education set. How do you teach hands-on? The math professors don't have to teach hands-on. I do, right? So I got a lot of courses on how to become a better teacher. A lot of courses actually had a, I told you I oversee all of the clinical education. So a lot of courses on how to, I do a good job with that. But the coolest patient one I saw that I participated in was high interval training. What's high interval training? HIIT training, high interval intensity. What describe what that is for me? What do you if we were to say, hey, next week we're all gonna do HIIT training, you're leading us, what are you gonna tell everyone we're about to do? Hardest output for short time, and then we get a rest, and then we're gonna do high interval, like high output stuff. So describe to me what would that look like for us? Like if we had you say, hey, we're going to do high interval training, what would you say? All right, let's go.
Exercise of high intensity.
Perfect.
Running in place, high knees.
Yeah, squat jumps as many as you can for 30 seconds, then stop. Sprint up and down the stairs 5 times in a row, then stop for 30 seconds, then sprint up and down 4 times in a row, then stop, then do it 3, stop. Right? So high intensity, maximum exertion for a little while, then stop. So the course I went to was high intensity interval training post heart attack and congestive heart failure. I had the same look, like, what are you talking about? So for anybody in this room, it would take us 40 seconds of burpees, sprinting up and down the stairs, high knees, jumping jacks, go out in the parking lot and run sprints, like that type of exercise. And that would elevate our heart rate, depending on your age, 160 to 180 beats per minute, this kind of thing, like right after that 40 seconds. You know what it takes for my patients after heart attack or with congestive heart failure to do that? Yeah, walk to that door, walk to that door, walk to that wall, do it twice. What is their heart rate what happened to their heart rate. It increased, right? And because they're older, like there's a cap to their heart rate. Their heart rate's up to 120, 130 just by walking here, where nobody in this room would get their heart rate up to 130. But what do I do with my patients once we get there and they're going, I do what? I give them a rest, and then I say, okay, you look better now. Let's walk back. Isn't that high intensity interval training? It's just what the exercise is to call it intense for them is way less than what we would do. But yeah, I do high after being in that presentation. I've done high intensity interval training for all of my cardiovascular patients my whole career. Work really hard. When it looks like they're getting tired, take a break, then go work hard again, then take a break. Like, we just didn't call it high interval intensity training. That was some other things they talked about too. Well, how cool is that, right? You take a concept I use with either my athletes or myself to exercise, and I say I can apply this to my patient, even though they have an advanced heart condition. So anyway, that's how we best serve our patients, and really fun. Um, Going back to continuing ed just for a quick second. So there's a million different things you could do for continuing ed. I also think there's a lot of scam artists and people who only want to make money because it's a requirement. God, you should see every 2 years as it gets closer to that May. Again, I said in Rhode Island, May every 2 years when our all PTs and PTAs in Rhode Island, we all are on the same expiration date. The mailers I get for the 3 or 4 months leading into that, like that time, I get take this course, take this course. Your license is about to expire. Take this course. There's a bunch of people that are there don't have great quality education, but they're going to make a lot of money doing it. So that is something that's a little problem. And that's actually one thing I really like about the APTA is that I know that if it's through the APTA, I know it's a standard of quality. Do you get the same thing in?
So they have to certify them to, they're certified provider.
Yes, yes.
Certified.
Yes, yes, yes. So the other thing with these continuing eds is you could get an additional certification. I could become Kinesiotape has an advanced certification to it if you've seen that. Instrument aided massage techniques where I'm using tools to massage people, that could have a certification to it. I could become a certified strength conditioning course. Yeah, I get continuing education and I get an additional certification out of it. Yeah, we could double up that way too. But yeah, we have to. There's some pretty good scams out there that nice. Somebody's making money. Nice for them. So the there also within the ABCA there are advanced certifications we could have within the APTA. So the APTA has this for physical therapists called certified specialists. It is the highest level of certification within the physical therapy world. Last time I looked, it was less than 10% of physical therapists in the United States have achieved this level of certification. I think it was 7% last I looked, but I could be wrong. So now there are each area of practice has some slightly different requirements, but in general, you need to have at least 2,000 hours of clinical practice in that specialty area. That's about 1 year of working full time, but in that specialty area. Each one has some sort of requirement of competency in administration, education, or research. It could be as simple as actually, I've had some people call me and say, Josh, I'm going for my advanced certification. Part of it is I need to give a lecture. Can I come to your school and give a lecture to students? Great, let's do it. So there some requirements there. And then, but the most toughest thing is passing that test. It's a big certification test. 3 to 5 hours long. I forget exactly how long, and all high level stuff. 10 areas that PTs could have specialist certification in: cardiovascular, pulmonary, clinical electrophysiology, geriatrics, neurology, oncology is cancer, orthopedics, pediatrics, sports, women's health, and wound management. Um, my wife has her pediatric certified specialist. I do not have any. That's the one thing she can hold over my head, and I'm sick of it. So I applied, and if I keep on track, I'll take the test for cardiovascular and pulmonary next year. Um, so now the PTA does have advanced proficiency. This is the PTA version. So for the advanced proficiency pathway, you have to do the core courses. They're all the same: ethical standards, professionalism, working with the PT and PTA team. And then you have to do the content specific courses. Whatever you're choosing to do, they have their own courses within it. There's also a requirement to participate in a mentoring program. So you have to have a PT that is, and it's a formal program. Week 1, you have to do this. Week 2, you have to do this. The PT has to watch the PTA execute skills with a real patient. So it's a very formal program. 8 different ways to practice for the PTA: acute care, which is hospital; cardiovascular, pulmonary, geriatrics, neurology, oncology, orthopedics, pediatrics, wound management. So sports is not on this list, and women's health are not on this list. 2 reasons for that. One, with sports on the field, like on the sidelines or on the court, that is an evaluation. So if an athlete gets hurt during sport, the PT can evaluate on the field, but the PTA, that's an evaluation. PTAs can't do any. PTAs can be involved with sports. It's just after that evaluation's been done. So that's the tricky part with that. And women's health, one, there's some internal techniques that are sensitive, and to delegate that to a PTA is really challenging. But also, there's some constant evaluation that needs to be done that makes it a little bit challenging for there too. Now, I do know some PTAs that do work in women's health and do a great job with it. It's just there's not this advanced proficiency for that. Other opportunities: being the clinical instructor for students as a PTA, student PTAs. Again, I oversee all of the internships, and all of my clinical instructors tell me, yeah, it's a lot of work, but I got a lot out of it too. You learn so much by teaching, um, and it's really good and really rewarding. Mentoring new grads, serving on the board of PT examiners as a PTA, you can do. What's the big roles of the board of PT examiners we talked about last week? What is it? Regulate rules, propose rules. Yep. And that was a great one. There's like 2 other ones I can think of off the top of my head. Determine who sits for the exam. Yes, you can go sit for that exam. Oh, there's 2 more. Yeah, there's 4 total. Grant licenses. Yep, either by examination or by endorsement. There's one other one. Handle complaints. Yep, handle complaints. Good. So you could sit on that board of PT examiners and do that work. And I know one PTA actually. She was a clinical instructor for me last year. She's been on the board of PT examiners in Rhode Island for decades. So she's an amazing woman. Volunteer with the FSBPT. So that is, what is, you guys remember what that group does? It's within APTA. They write the exams. Yeah, they write the licensure exam. Actually, I just volunteered and was accepted. Like I had to apply to volunteer. It's so stupid. But I was accepted to help write the next version of the licensure exam with the FSBPT. So that'll be fun and awful at the same time. But I did it because I wanted to become a better exam writer, And I actually had some students that struggled passing the exam, and I was like, all right, well, let's go dig into this a little bit. Um, so looking forward to that and dreading it at the same time. Um, allowing interested parties to job shadow, I think is great. PT month is October every year. But you could also you could instruct, you could be the education for you could set up a continuing education course and you could teach it. You could also do community education. You could just go to the YMCA and lecture about, hey, this is diabetes. Here's we're going to run a fall screen for at this place here and there. You could run exercise classes and different workshops. You could really do a lot of other things. Looking at the demographics of PTs and PTAs, PTs private outpatient. So that's your if you drive around any place, any town, you're going to see them. High Bar, Papa's PT, Elite, Elite and Ivy, Bay State. I don't know any others that you guys drive by. University, yeah. So university, I think is a little bit different than private outpatient. It's physician owned, but yep, that's an outpatient place. So those are the kind of that's what private outpatient is. Hospital outpatient, so that's attached to the hospitals, but it's still outpatient PT. Inpatient hospital is next most common place for PTs to work. Academic, that's what I'm doing. About 10% of us do that. Home health, 6.5%. Skilled nursing facilities, and then school systems. PTAs, hospital outpatient and private practice outpatient are the biggest ones. Inpatient hospital. SNF isn't on this, the skilled nursing facility. That's not on this list. And I tried to find updated data on that, and I just couldn't. What I will tell you about skilled nursing facilities for the PTA, one, I think it's a great place to work. Two, hospitals and skilled nursing facilities provide care 7 days a week. When you are my advice to anybody that doesn't have family obligations that changes their life. Um, Working on the weekends and holidays at a skilled nurse facility is a great way to save up for your next car, down payment on the house, pay off student loans, like because you can just grab a half a Sunday and you can work and you get paid decent amount and then you don't have to worry about anything and you go work on the holidays and especially those weird holidays like Christmas always stinks to work but um other holidays that are holidays but like what's a holiday that's not really one. Yeah, that's a great example like yeah I'm gonna go work on Monday get time and a half. It's just Monday. President's Day. Who's celebrating President's Day? Yeah, that's a great example of it. Um, yeah, you make decent amount of money. The other thing about skilled nursing facilities for the PTA, there's a little bit more of a job growth path. I know more PTAs that are directors of rehab. They're the supervisor of the rehab department as a PTA more often in SNFs than any other setting. I know one person that is the clinic director for outpatient clinic, but I only know one. I personally know four different PTAs that are director of rehab of that skilled nursing facility. So a little bit better if you're interested in a career ladder that gives you some. Not everybody is. Um, I am the rehab director of the home care place that I work at, and I was just saying, I drove from Warwick to here. Anybody else drive by the Powerball signs on the way here? Or am I the only one? So, I mean, when do you guys drive by that sign? What do you guys do? Am I the only one that daydreams like, ah, if I scooped up that 40 million, what would I do? I'd continue to teach and I continue to treat patients, and I would definitely give up that administrative job in a blink of an eye. Not everybody's like that. Some people like it. And especially when you talk about burnout, there is burnout in care. Giving care to other, like, it can be emotionally draining. So sometimes, I was wondering this out loud in my last class. I wonder if the reason I still like treating patients as much as I do is because I spent so much time teaching and I do the administrative stuff. I don't do it all day long. I wonder if that's why I still like it as much as I do. Um, because it can be draining. But so I think that's something about the appointment of the PTA worth considering. Average salary. So this is nationwide salary in the Northeast. We make a little bit more than kind of the flyover states, the Midwest. So nationwide, and it's also new grads versus 30-year veterans. So it's everybody. Nationwide average for PTs, 89,000. PTA, 57,000. I will tell you in Rhode Island, PTAs, new grad PTs, 75 grand is about the going mark for a new grad PT. For PTA, I was texting one of my former students just the other day. She was asking me for jobs. I sent her five that I knew of just off the top of my head. I didn't go searching for it. And the average salary was $61,000 for those five jobs for a new grad PTA. Not bad. And I'll pull this up. So thinking about this, so here at PCRI, start to finish, 17,500 for in-state. I don't know about out of state. In-state, 17,500 from day one, all your prereqs to graduation day. So whether it takes you 5 years to do prereqs, like if you do all of these classes, 17,500. So, 18 grand, you're going to make 60-ish. I know that number is a little lower, but I know some PTAs that do get offered less and take it for whatever reason. So you're going to make 55 to 60 for your first job, and it's going to cost you 17, 18 grand to do it. Solid math, right? That's what you were saying earlier about the 4-year degree. Like, we got to worry about that math. That's what you're saying too, right? All right. So PT starting out 75-ish is the number I know of right now. URI, where I went, I love URI in-state tuition, year one, 24 and change, year two, 24 and change, year three, 13. 60 something thousand, just over 60,000. Not including, they say their estimate for housing and personal expenses an extra 20 a year. So that's over 100 grand. And guess what those numbers don't include? 4-year bachelor's before you even get into the program. And then when you look at these numbers here, because of the student loan debt, I know PTAs that can buy nicer cars, buy homes in the more desirable neighborhoods or earlier in life than PTs can. Research says, on average, it takes 10 years before the PT breaks even on their education investment compared to a PTA. So PTAs get a 10-year head start. After 10 years, yeah, they're making more money and they've paid off enough student loans where it starts coming out ahead. Boy, that's tough. That's tough math to start figuring out. So anyway. Oh, I do know of some that, yes, that they have, some have direct connections and work with those bridge programs. Yes. Yeah, the short answer is yes. What that means varies depending on place, but yes, the short answer is yes. Yep. And you know what? So going back to those bridge programs, the bridge programs are designed because you're going to be working. You're expected that you're going to be working as a PTA while you're going to school. Now you're going to be making 60 grand a year. Yeah, it's still going to cost you 100 and change to get out, but you're also going to be making 60 grand a year while you're doing it. That's pretty good. Um, so demographics, 69% of PTs are female, biggest age bracket, 30 to 34 years old. PTA, 78% female, and biggest age bracket, 45 to 49. Why do you guys think that PTAs on average are older than PTs? Yep. Any other second career choices? This is my second career. Um, yeah, yeah. And man, if it's going to take us 10 years to recoup that cost of PT education, I had one student, she just graduated a couple years ago. She was 55 when she graduated. So I don't know if she's going to be working 10 years. Like, wants to get in and get going. He wants to make that career change. Um, so yeah, I think that's another reason for that. Why I will always be against the PTA being moved to the bachelor's level because we're going to be losing a lot of PTAs that want the second career type that are going to be great PTAs for a while. So what are some tasks that PTs? This should say PT and PTA, not PTA twice. So fix that. Um, so here's a little side by side comparison. Uh, Review of medical record, that should be on both sides. Anytime you're seeing a patient, the first thing you're going to do is you're going to be reading their whole medical history for a long time before you even shake their hand and say hello. But other things PTs can do: examination, evaluation, obviously diagnosis, make the calls, treatment plan, prognosis, reevaluation, discharge evaluation. PTAs, in addition to review of medical record, can do interventions that are established within that plan of care. Tests and measures. Yes, I am the one selecting which tests we're going to do. You're going to be repeating those tests to make sure the patient's making progress that you think they should be making. Communication is probably the biggest thing that you guys get to do. Patient progress, achievement of goals, change in status, any concerns. Communication is going to be by both the PT and PTA, and I think this is the most important thing that we do is actually communicate. One, we communicate that we care about the patient. Two, we communicate what we think we can do about it. But that's going to happen in both written, verbal, and nonverbal communication. Written medical record, we're going to be documenting everything we do, so it's really important that we can document clearly and write well, but also for patient and family education. We'll get into more of the verbal and nonverbal communication in a little bit. Consultation is something else that a PT can do. It's a form of evaluation. Um, so that's the kind of thing where especially happens a lot in the hospital. Hey, we just want to consult on this person. All right, I'm going to roll in. I'm going to say, what's the deal here? They're going to say, well, this person fell, but they don't think they need PT. And I'm going to say, why don't you think? Like it'll just be a verbal, like, oh, you don't think so? Okay, my recommendation is this. It could also be, hey, we had somebody else come in. They have a wheelchair, but we don't think it fits well. Can you go look at it? So it's not really a formal evaluation. I'm just going to look at it and make some recommendations just on a. It's a type of evaluation though, but it's not quite as in depth as a formal evaluation. Administration can be done by both PT and PTA. Again, that's where you're the supervisor of the facility or the director. Instructions to other professionals, peers, and public. We talked about research. We PTs and PTAs can do, especially with our electronic record keeping. It's a lot easier to do research. At the end of the year, I could, with my electronic record, I could say, pull up all of the patients I saw with an ankle sprain this year. And how come these 10 patients got better in 5 visits, but everyone else got better in 8 visits or more? And I could do that research with this. So it's something we could do. I I like reading research. I don't like conducting research, so that's not something I would do. But it is something you could do. So six primary types of communication: verbal, words we say, tone, speed of message; nonverbal, facial and body language. I will say nonverbal communication, just our facial and body language accounts to about 55% of communication of the message. Um, the exact words we say is very little. It's about 7 to 10%. And then the tone in which we say it um, matters a lot more. I had a patient. I don't speak a lick of another language. Whatever section of the brain that allows people to learn. Who is here speaks more than one language? Yeah, not me. I've tried a handful of languages. French all through high school, Spanish in undergrad. I took German for about a half a day once, and I said, "This is nice." Um, Italian. We went to Italy for our honeymoon. By the end of the week, my wife was speaking Italian, and I'm going, "What are you saying?" That section of my brain is just turned off. Um, but I had this one guy. He was blind, not in the chart, by the way, and he only spoke Portuguese, also not in the chart. So I walk in and I say, "Hey, Mr. Johnson, I'm Josh." Can't see me, and he doesn't know. Luckily, he had somebody there, so he's blind and he doesn't speak English. Oh, okay. So that guy, great guy, really enjoyed working with him. Um, I don't know what he was saying, but I knew when I said, "Oh, let's do one more lap," I knew when he was not going to get up off that chair again. I don't know which swear words he was saying. I know he was swearing at me though, and I knew that was the end of the session. Um, Again, I knew it because of his nonverbal communication and his facial language. I knew it because of the tone, speed, and volume of his message. Again, I don't know what the words he was saying, but other than the message was, "I'm not doing it anymore, Josh." So yeah, really, really important, the tone and our nonverbal communication. Reading, we're going to be reading a ton, patient charts, medical records. We're also journal articles, professional literature, textbooks. We're going to be writing all the time. We talked about listening is the active skill. Um, when you guys participate in class, when you guys ask me questions, when I ask questions and you answer them, that's active listening. When you're just quiet, like, yeah, you're hearing, but active listening is like it is an active participation. And you guys ever talk to somebody that just say, "Are you?" It happens a lot on the phone. If anybody ever talks on the phone anymore, "Are you still there? Like, are you here?" Like, that's what hearing is. Listening is, "Oh, really? And then what did you do? Tell me more." Like, it's engaged in the conversation. And then we have electronic documentation, but also messaging. Electronic messaging has exploded in the last really 5 years, although a little bit before then too, because we have some more secure ways to message electronically. But that happens a lot as well. Use of nonverbal communication can definitely change how we communicate. When somebody's in the hospital or skilled nursing facility, where exactly is that patient? When you think of, like, oh, you got to go work in the nursing home, the patient's in room 304 over there. Where is the patient going to be? They're going to be in the bed. And what does every single practitioner do when they come in and they talk to that patient? Where do they go? They stand next to them and they look down, and they might be doing a task, and maybe taking a blood pressure, something else, right? But they're standing over that patient. What does that patient feel like when we stand over them all day long? Small, powerless. They're literally being talked down on. Did anybody ever experience that? I think there's a couple older pharmacies. The pharmacists used to be like 4 feet high and then talked down to you. Like, it's a very weird feeling to be talked down on. First thing I do, whether, and then when I go to patients' home, sometimes they're sitting in a recliner, sometimes they're still in bed. First thing I do, you got to get eye to eye with that patient. Pull up a chair, sit next to them. Patients who use wheelchairs as their form of locomotion, you got to get eye to eye with that patient, whatever level they're at. Um, it's going to improve. That's nonverbal communication to say, I'm here with you. What are we going to do together? But our posture matters. Our arm positions could matter. Completion of other tasks like documentation is nonverbal communication. It means we care less about them than the task we've done in front of us. How many of us, has anybody ever been at a doc's office where their docs are just on the computer and they never actually like take their eyes off and look at you? How does that feel? You don't want to just say like, "Hey, man, I'm over here. Like, just look at me for a second." Um, we have to be a lot more careful with that. I was talking with one of these conferences and courses I went to. I was talking with this guy. He was a neurologist and he was a brain surgeon. And we're all wearing "Hi, my name is Josh" stickers. He goes, "Oh, Josh, what do you do?" I said, "I'm a physical therapist." He goes, "Ah, that's no brain surgery." I was like, "Did you become a brain surgeon just to crack that joke to anybody that's not a brain? Like, are you the only people you avoid talking to are rocket scientists because they're like, yeah, but there's no rocket science." Like, he goes, "No, no, no." He goes, "You're misunderstanding. You guys have an infinitely harder job than I have." I said, "Doc, thanks. I don't know if I agree with that." He goes, "No, but Josh, listen. Patients come to me, they've got a huge problem, and I'm one of the few people in the world that can operate on somebody's brain. But we put them to sleep. I cut them open. I do what I can, and then I stitch them up, and then I send them along their way. The next morning, we got a big old headache. They didn't sleep well the night before. They had hospital food sucks, bells and whistles going off all night long. And then we in the PT world come in and we say, what? Hey, let's get up. Let's do exercise. The last thing these people want to do. And we are the ones that get them out of bed and they get them back home wherever they need to with whatever function that we can, right? He says that is so much harder to do than what I'm doing. Yeah, I've got a tough job and it's high risk, and there's only a few people in the world that can do my job. He said it's way harder to get them out of bed than it is to operate their brain. I thought that was really nice. I don't know. I don't know if that's exactly true, but it was very nice of him to say. But that's why this stuff matters. That's why this stuff matters. And the doc doing rounds that's going to see 18 people in the next half hour doesn't need to, can stand over that person. If you don't sit eye to eye with that patient, have good posture, pay attention to them instead of your documentation, you think you're going to get that person with a splitting headache, hasn't eaten in 3 days, feels like crap, and just doesn't want to move. You think they're going to get them out of bed? Nope. What's going to happen tomorrow? We got bad weather coming. If you're doing all of those negative things, your patient's canceling that visit. It doesn't matter if they've got snow in their driveway or not. They're not coming, right? So that stuff matters. It matters so much more to us in our jobs than it does most other healthcare professions. Um, you can look at this video. It's 2 minutes long. Feel free to look at it. It's how different nonverbal communication can be impacted by cultural norms. It's pretty humorous, and it's only 2 minutes, but some hand gestures that can be used in Northeast, well, United States. That if you go to other parts of the world, or if you have patients from those other parts of the world, how it can lead to miscommunication. One other task that I used to do, I don't want to do it today because I have other things I want to talk about. I used to go around the room and have everybody say, "Josh, you're such a good teacher," but with a different tone, body language, and how it means different things. So some would be genuine, some would be sarcastic, some would be angry. We're all saying the same words, but because we're all of our nonverbal communication, it means very different things. So I don't want to do that because I want to talk about some other things, but that's how it can be really important. Let's slide back to this. Characteristics of PTAs. Two major take-home messages for that. What were they? Mostly female. I think it was what 79%. I think was what that number was. 78. And then what's the other characteristic we talked about? Age, yeah, the biggest age is age brackets 40 to 45, so older than PT side anyway. Requirements to achieve specialization for the PT. There are 3 different requirements. Oh, that's the education. Oh, yeah, but I mean the specialization. 2,000 hours of clinical practice, pass whatever the exam of the topic you're doing, and then there's some sort of administrative education type requirement. How about for the PTA, for the advanced proficiency pathway? There's 3 elements to that. Oh, that was continuing education. We'll get there in a little bit. Yeah. Advanced proficiency pathway I'm talking about here. Not 2,000 hours. No. So it's do the coursework. So there's core courses and then there's topic specific courses they have to do. And then the other requirement is the mentoring program. Yeah. Clinical areas where specialization is available for PTs versus PTAs. The 2 that is not available for PTA is sports and women's health. There's one acute care is available for the PTA, but not for the PT. That was another one. So glance at those. So how many continuing ed hours are required? 24 every 2 years. And why is it so important? There's like 2 or 3 reasons. Stay up to date. Be a good practitioner. You are displaying, you're making sure you are an up to date clinician. Any other reasons? Advance your skills. Yeah, yeah, man. If the world of PT dried up, I would immediately go chase wound care because that's something I could make that job will still exist. There's plenty of wounds out there and they're tough to heal. Great, go for it. Yeah, get new skills. Any others? One other major reason. Yeah, it's required. It's required to have another license for the next. Um, Education of the PT first. I think that's where were you going there first? Is that where you had said first? What's the education path of the PT? Bachelor's first, and then some sort of doctorate level degree that includes didactic, hands-on competence, and clinical education. PTA, associates, yep, associates level, and then techs. No requirements on the job training. Document it well, but yeah. Role of CAPTE, what do they make sure of? They just oversee all the programs, make sure we're doing a good job. The activities performed by PT and PTA, there were a few new ones. So we've talked before with that patient client management model of examination, evaluation, prognosis, diagnosis, prognosis, and then plan of care, and then intervention, and how PTs do everything except intervention, both PTs and PTAs can do. There's a couple of new activities that we looked at here: research, administration, consultation was the one that PT onlys can do. Because it's a form of evaluation. So glance at that list. There were 6 types of communication: verbal, nonverbal, reading, writing, and then was it electronic? Is that the other one? Yeah. Um, Actually, I read a story. A guy got fired from his hospital job because he used the hospital messaging that's supposed to be, I need an orthopedic in room 304. What, we professional medical, and he was using it as a dating tool. Like, who is the nurse in room 403 that I just saw? Like, yeah, not sure that's the best use of that. So electronic, you're not going to do that. Communication tools, we talked about a little bit. Electronic is the big one. Um, Others, written instructions for patients and families. Dramatize nonverbal communication and explain their significance. That's what I said. Like we could all say the same words. Josh is such a great teacher, and it could mean very different things. Um, and career development opportunities, including what are some options for that? Like mentoring students, any others? Putting forth community workshops. That was the other thought to that. So glance at that stuff. All right. Do we have any questions on today's material? All right. I want to go over one other thing. See if I can get this. So, I talk each week, I talk about how are you guys doing? One, how are you studying? Two, are you keeping up with it? How are you feeling about studying? If things start to dip, these are the admission guidelines for the PTA program. There's a link on Black. I love our admission pro because it's 100% merit grade based. I'm rooting for every single one of you. If one of you emails me, Josh, could you get me in? No, I can't. I don't know who's applying, who's getting in, who's not. I am completely blinded by the process. Whatever grades you get tallied up into a score, and the top 24 students that get the score get offered spots. And if someone says, I applied, but I don't really want to do this anymore, number 25 on the list gets offered a spot. We accept 24 students per year. Yep. So we're a little bit down recently. We have a lull with this whole COVID nonsense that's been happening. I think last year we were somewhere in the 40s. Historically, we're between 60 and 80 applicants. So it is not easy to get into. For a little while, I don't know how true this is, but for a little while, it was CCRI had more applicants with less seats than URI's DPT program. URI would accept 30 students and get 60 applicants. CCRI would have 24 seats and 80 applicants. So for a little while, CCRI puffed out their chest and said, it's harder to get into our program than URI. That's exactly true. I mean, hey, math is math, right? We only have so many seats, we have more applicants. So it is not easy to get into the PTA program. That's why I spend time talking every single week. Next week, we're going to talk about how do we take a test and how do we become better test takers? Because I want to see all of your success. I want to make sure you understand the importance of your class and getting good grades in it, especially the three classes I always mention. This class, medical terminology, and anatomy. Those three biggest classes that are going to dictate whether you get into this program. So all it is, so you can read through the exact requirements on your own, but the big things I want to bring you down to is when we talk about points. All of your classes, all of your grades, all of your classes, a couple of things translates into a point value. You apply to the program, you have so many points. If you're one of the top 24 students with points, you get offered a spot. If you're the 25th, you don't get offered a spot unless somebody says, you know what, I got in, but I can't do it. That happens. Roughly 4 to 5 students each year gets in, but decides not to, join us. So, first step is your GPA, multiply that number by 10, a maximum of 40 points. There's your first set of points. The next up, and what I keep referencing these classes, anatomy, this class, PTA 1000, and then your Rehab 1010, that's your medical terminology course. Those are worth 40 points apiece. So I keep saying like that medical term class is really important. Don't fall behind. It's easy. It's easy to like kick that down the road, but make sure you don't do it. That's a 1 credit class, right? Anatomy, is that 3 or 4 credits? 4. 4. As far as points goes, they're weighted the exact same. Get an A in that term class. Actually, it's weighted the same as this class. This class 2 credits. Man, you got 1 credit class that's worth the same amount of points as this 2 credit class. You better do a good job. And that's why I keep saying, don't forget to do that. Don't forget to do well. Like that's important. Anatomy's tough. How many people get an A in anatomy? I never got an A in it. My highest grade in anatomy was a B plus. Never got an A. Anatomy's tough. Anatomy's tough. So whatever your grades are, they translate into a GPA. So, an A minus is a 3.7. All right, you get 37 points if you get an A minus in those three classes. You get an A, you get a 40. You have to get at least a B minus. So if you don't get a B minus, then you can't apply. That's the prerequisite cutoff. So B minus 27 points. So you got to get above a B minus or above. Here's why I keep saying all those three classes are important. Who said last year or was it last week or the 2 weeks ago? There's some classes we don't like. Psychology was some of them. Math class, was there a math class? Was you that didn't like the math class? I pointed in my war class. I was like, you don't like math, and then I was like, oh wait, no, it's TJ. Never mind. Guess what? The difference between a B minus and an A in math class that you don't like, if you get a B minus, you get 3.375 points. If you get an A, you get 5 points. 1.7 points. That again, the difference between an A and a B minus is huge in a class, right? Not that much as far as points goes. Difference between an A and a B in med term. A and a B med term is 10 points. That's a big difference, right? That's why I keep saying these three classes are the ones you really got to focus on. Now, you still need to do a good job in the rest of your classes, especially because all of your grades will translate into your overall GPA, and that's another big chunk. So it's important to do well, but man, those three classes you got to do well. The other is this AccuPlacer test. Oh, AccuPlacer can be taken no more than 3 times. I couldn't remember last time. It's written right there. How many people have already taken the AccuPlacer? Do you know your scores? So you got to find out what your scores are. Because as long as you scored 87, you get 28 points. If you get below 87, you can still apply the program, but you don't get any of those points. Big deal. So if you get a perfect score, you get 40 points. So this is a big chunk is just by doing this AccuPlacer. You could also have a bachelor's degree. That'll give you 40 points. So I know some people have bachelor's. Or you could also take these classes and get an A in them. And you'd get 40 points that way. So your job. So the application is February each year. So you guys can't apply right now because you're taking the prereqs right now. So you have to apply next year. But your job is to find out what did I get on that. How long ago did you take AccuPlacer? So a little while ago, and you don't know your score, so you don't know if you need to take it again or not. So that's when I talk to students every single year, I often get that. Yeah, I took it. I don't know what I scored. You got to figure that out either with your advisor or if you have access to it. I don't know if it's on my CCRI. Does anybody know if you can access your scores on AccuPlacer with that? I don't know. But anyway, so and then down below, there's tiebreaker criteria as well. Feel free to look at this again. The link is on the website. I will also show you this person, Deb Watson here, is such an amazing person. She is incredible at her job. She cares about her job. She's in charge of admission to the program. She's the one that tallies all this information, answers student emails. If you have any problem at all, reach out to her. Talk to your advisor as well, but reach out to Deb because she's an amazing person, an amazing resource. Now, I can't tell you exactly what the scores can to get you in. It changes every single year. Depending on who applies, who gets in, that number changes each year. I don't know the number actually for this group that's in their first year now. The second years that are finishing up. This is their last semester of the program. Their average score was 170 points. Again, it fluctuates a little bit. It might be 150 when you guys apply. It might be 190 when you guys apply. The max score you can have is 210 points. So down there, max total points 210. You get perfect scores on all of those requirements. The maximum you could possibly get is 210. So 170 out of 210, that's a solid student. That's somebody who's gotten really good grades. Every single year, we have between 2 and 5 students who have above 200 points to get in. So it's not easy to get in. That's why I keep saying every single week, do good on your classes. How are you feeling? Make sure you study hard because it matters. But let's do some quick math. We'll let TJ off the hook since he said he was brave enough to say I don't like math. So we'll let him off the hook. Somebody else to do math with. Let's talk about these 3 classes. So what grade are we going to get in midterm? You got to get an A. That's a class you got to get an A in. It's not all that complicated. You're going to learn prefixes and certain, like, get an A in that class. All right, how many points does that give you? 40? 40.
30 points.
What's that?
Is that the rehab one? Rehab 10.
Oh, is that? Oh, all right. So they are weighted differently. Sorry. Yes. Yes, this class, yeah, anatomy is weighted a little bit more. All right, so that's 30 points. Sorry. Yeah. Good eye. All right, how about this class? What are we gonna get? What grade? Well, we're aiming for an A. How many points does that give you? Another 30. All right, anatomy. What grade are we gonna get in anatomy? I think that's a honest, like, that's a tough class, and you're gonna work your tail off and get a B. And yeah, maybe you get an A. Like, yeah, I think that's a class that you say I might only be getting a B because that's a tough class. Let's be honest. All right. How many points do we have total now? 90. All right, but what's our GPA? If we've gotten 2 A's and a B, our GPA is roughly what? 3.5, somewhere in that range. So if we get a 3.5 GPA, how many points does that give us? Another 35 if it's a 3.5. So we're up to 125. Okay. Roll down to our AccuPlacer. AccuPlacer between 28 and 40 points. Let's call it 30, just for simple math sakes. What number are we at now? 155, I think. Okay. Not bad. And now we round out with all of these other classes. Your anatomy 2, your math class, psych, what other, English 1010 and those 2 class, right? Each class is up to 5 points there. You do okay on 4 of those classes, there's your 170. Okay, not great. Like, just do okay. Just get your, solid B. Hopefully, you get more than that. But there you go. There's how you get to 170. So it's not easy, but is it impossible? It's not impossible. Now, again, I don't control who applies. I don't control. Maybe the average number in the year that you guys are applying is 185. I don't know. Maybe it's 135. I have zero idea. But I could just tell you historically that 170 mark is about the average. Some people get in with less, plenty of people get in with more, but that's what I would tell you need to start shooting for. So when you don't want to study math, when you're sick for a week and you think like, I'll do midterm next week. Okay, but get back on it because it's really important. That's a class that feels like it's not important because it's 1 credit on your own. Big points. I'm rooting for every single one of you. And the reason I spend valuable class time going over this stuff is I want to make sure every single person understands what it's going to take to get into the program. It is competitive. Um, and if there's anything I can ever do to help you, you let me know. But I'm going to continue talking to how we study, how we take tests, and try to do everything I can, and just make sure you understand the importance of all of these classes. Okay. Do we have any questions on admission to this program or any other questions about the program? Yeah. Talk to your advisor and make sure that they're looking at this program. The advisors you guys have, the CCRI advisors, they're great people. They work their tails off. Do you know how many programs there are at CCRI? There's 100, like it. So it's impossible for the advisor to know every single program. So make sure you bring this up and scroll down to that point and say, do I have to take it or not? If you said you took that, or is it? Did you take one of these classes? Yeah. 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 Gotcha. Talk to them because I will tell you one horror story. I had one student who was an amazing student. Um, and he emailed me, Josh, I didn't get in. I missed the mark. Um, I talked to my advisor, but I was hoping to see you in the fall, but I didn't get in. I said, what? That doesn't make any sense. Like, you're a phenomenal student. What happened? Yeah, my advisor said I got a B plus in a few classes, not in the 3 classes I was talking about. I got a B plus in a few classes, and my advisor said go retake those and reapply. What's the difference between a B plus and an A? Not even a full point. So he's going to do that for 3 classes. He got a B plus in. How many points did he get? You know what he missed? He took the AccuPlacer once, and he got like an 85 on it. So go take it again and get yourself some points, man. Once he had those points, he actually ended up getting into the program when he needed to. It was great. I'm so happy he did. Um, but yeah, it was the AccuPlacer that his advisor didn't even look at it because they've got a lot on their plate. So your job is to talk to the advisor and say, listen, to get into the program, I have to do one of these things. And they're going to be able to look it up and say, oh, no, you're all set. You got these many points for this. And if you don't trust your advisor on that, this woman right here will definitely help you. Deb Watson's one of the most amazing people. So you can tell her I said she's amazing too, because then she helps you out faster. So yeah, check on that. Any other questions about admission to the, yeah. So to these, so read the website and you'll see all of the requirements. The AccuPlacer. Yep. Yeah, one of those you've got to do. Talk to your advisor if you make sure you did it the right way. Yeah. Yep. Any other questions? So next week we have regular class. I don't have the material ready yet. I hope to have that done by Saturday. I'm going to work hard on it, and I will apologize in advance if it's not ready the weekend. So we have regular material next week. Part of our material next week, we're also going to talk about how to take a good multiple choice test. Next week, we'll also have a practice quiz ready for you. There'll be a couple of questions on each PowerPoint, each topic, to make sure that you can, one, it's good practice to practice for the exam of just multiple choice tests, but also it'll help you just guide your studying. Like, you need to you got these questions wrong on this PowerPoint, spend more time over there. That's not meant to hurt you. You'll have, I think I give 5 opportunities to take it. So the goal is to do a good job and get a good grade on it, but it's to guide your studying. And then the following week, we're going to have an exam. The exam will be computerized. You can take your own laptops with you, but we'll also use the computer lab that's downstairs at the back end of that hallway. So it's straight that way, but down one level. Okay. Forget the exact room number. I'll look it up for next week. So that's what's gonna happen next week, and then the following week is our first test, okay? All right, study hard. If you need anything from me, let me know, okay? Good luck studying.